recently had orthopedic surgery here with us at Packerland Veterinary Center, and I'm here to go through some basic information on home care for your pet. You would have received a set of discharge instructions, likely in a folder that looks like this. Once you open it up, you will see your discharge information and all the handouts on one side, and then brochures and information on products or other treatment recommendations in there as well, in addition to a medication sheet. So we'll go through each of those options for you guys. The main thing is that all of your information in general will be on the discharge instructions form. So this is going to tell you when your pet sutures come out, if there's follow-up appointments, what we found during the surgical procedure, and any specific recommendations geared towards your pet. Most of our orthopedic patients also will have a fentanyl patch in place, and that will be in the fentanyl patch handout, when to take that off, things to watch for, etc. Those you will go through with your technician at discharge, and that will be geared specifically towards your pet. Other handouts that will be in your folder, the one that I'm going to discuss is immediate post-op care of the orthopedic patient. So this is going to be general recommendations for an orthopedic patient that has had a procedure. And the main thing is we want to keep the activity restricted as directed by the doctor. And that means no running, no jumping, no using flights of stairs, 3 or 4 stairs into or out of the house is fine. No jumping on and off the furniture or the bed, no going for walks. When we go outside to go potty, we want to limit that time frame to about 3 to 5 minutes, and the pets must always be on a leash when outside until the restriction period has ended and they are cleared to begin activity. We also don't want them playing with other pets, so if you have other animals in the house, we really do want to keep the patient and the other pets restricted from each other, because it doesn't take very long before the patients really start to feel good and they will try to interact and play with the other pets. We don't want them to have free access to toys. We really just want them to be pretty quiet, confined to a small area. They're not allowed to pace around the house or anything like that. And really should be kept as quiet as possible for the duration recommended. That will give us the best results and will also hopefully prevent any complications. So when your pet goes home, initially they will likely have an incision in place. So you want to keep an eye on the incision. You'll want monitoring for any redness, abnormal discharge, swelling, any changes in temperature, whether it's really hot or really cold, anything out of the ordinary, please call the clinic. We really would rather you call 10 times a day than worry about anything, or not pursue something that could be a complication soon enough, where we can get things under control very quickly. The incision also should be kept away from the pet in terms of them not licking or chewing at it. 1, they can pull out sutures. 2 is their mouths are full of bacteria, so they can cause infection. So if we can keep them from licking or chewing at the incision, again, we'll get better results and better healing all around. Some pets may go home with a bandage, a splint, some type of a brace, something covering the area. If that is the case, you want to keep that apparatus extremely dry and clean, and also don't let them lick or chew at that. Think of like when you're wearing a bandage and you wash your hands and your band-aid gets wet. Your skin underneath starts turning white and gets kind of funky looking. Same thing can happen with any of these apparatus that are in place. If your bandage gets wet, it can cause a lot of skin irritation, including infections, skin sloughing, sores that develop. So again, any dressings that are present on the leg or a surgical site, you want to keep extremely dry and clean. And really follow your recommendations for when to have those changed. Changes should be performed by a veterinary professional. If bandage changes are done incorrectly, you can cause some damage and some skin problems, and some issues can be very significant. So again, it should be done with your veterinary professional on the recommended schedule. The pets should never be allowed unsupervised without being restricted in some way. So if you're going to be going to work, you don't have to be with your pet 24 hours a day, 7 days a week. but you do need to make sure that anything that they can do to get into trouble is minimized. So it is recommended that when you're gone, at night when you're sleeping, that they are confined to a small area, such as a kennel, a laundry room. I've had people gate off sections of hallway, but in a small confined area where there's less potential for them to get into trouble. Again, we have to be their brains for them, and they don't quite understand that they're under activity restriction. Typically pets tolerate restriction pretty well. If there is a pet that has a lot of anxiety, if they're really high energy, if they just are not doing well with being cooped up, please let us know. There are some medications and supplements and things that we can utilize to help with the activity restriction and the anxiety issues. Your pet will be going home on a variety of medications. Typically they will be going home on an anti-inflammatory pain medication, a pain patch, a true pain medication, and then some form of antibiotic therapy. So please give the medications as directed. We'll go through some medication scenarios shortly, but the bottle should have your instructions on there, and then we'll also have a med sheet that you can check off so that everyone in the family that's helping take care of your pet will be able to coordinate medications so everybody will be on the same page. Sometimes because of activity restriction, pets can gain some weight, so we may need to do a little dietary adjustment. Typically pets can go home on their normal food. The first 2 days following surgery, because anesthesia can cause some nausea and vomiting for about 48 hours, we do recommend feeding smaller, more frequent meals. So instead of 1 or 2 larger meals per day, we recommend 2 or 3 smaller meals per day for those first couple days, and that's going to be less irritating. Also, smaller amounts of water more frequently as well. Thereafter, you can resume the normal diet schedule. If they seem like they are a little nauseous or having a little GI upset, you might want to feed a bland diet, and you can do a home-cooked bland diet, such as boiled hamburger or boiled chicken and white rice. After you boil the meat, just make sure you rinse it off really well to remove any fat. The fats can be very irritating. And in terms of the rice, you want to use the traditional rice, not the minute rice, because the traditional rice has that outer covering still intact that the minute rice does not, and it's that outer covering that has some medicinal properties in terms of calming the GI tract. So, and you can feed those quantities in the same amount. So if your pet normally gets a cup of the regular diet, you want to feed a cup of the bland diet. If cooking for your pet is just not an option for you, there are some commercially available bland diet options. It's a prescription food you can get from us or your regular veterinarian if you're a referral patient. So, but please, contact the clinic or discuss it with the technician at Discharge if you have questions about that. Some pets are a little bit more prone to weight gain also. So sometimes switching to a light version of the regular food or decreasing their caloric intake by about 25% can help prevent weight gain during the activity restriction period. We do expect that there is going to be some swelling and bruising present after surgery, and that's normal. So if you're seeing some redness, some irritation, it's likely a normal scenario that does improve over a few days' time. But we also expect that there's going to be some swelling as well, because there's been some major things that have happened with that limb during the surgical procedure. And we do recommend doing some compressing in order to help reduce the swelling. So initially we want to use a cold compress. You can use a gel pack, you can use an ice bag, you can use a bag of frozen peas. Just remember, if you're using the bag of frozen peas, you don't want to eat those peas. So you can keep reusing the same bag, just label it for your pet. So that way you know that that's theirs, and you're not going to try and make it for dinner one night, because they're probably not going to be very good. And basically we want to have a light barrier in between the skin and whatever your frozen option is. And we want to try and ice the surgical site every 3 to 4 hours if possible, at least 2 to 3 times a day. But those first 3 days we want to try and get that like every 3 to 4 hours, 2 to 3 times a day minimally, for about 5 to 10 minutes if you have a small dog. If you have a larger dog, we want to go 10 to 20 minutes for a larger dog. And what the cold compresses do is they help to shrink those blood vessels and help to prevent swelling from occurring. Now, we're not going to be able to prevent all swelling from occurring. It's just pretty impossible. So the second 3 days after surgery, so days 4, 5, and 6, we're actually going to change to a warm compress. And our preference for warm compresses is a hand towel run under hot water and then just wrapped around the surgical area. Use of heating pads, the things that you warm up in the microwave. I have had people use those. There can be a little bit more risk of injury with them. They can develop hot spots, and with the leg shaved, oftentimes pets can be a little bit more sensitive in terms of their skin to heat, so we do have the potential for developing a burn or that type of thing. So the towel run under hot water works great. The drawback is you do have to switch it out and reheat it a little bit partway through. But the moist heat tends to penetrate better, and we will see swelling resolve pretty quickly with that. With the warm compresses, we want to do those 4 times a day, and no matter the size of the pet, we want to do it for about 15 to 30 minutes at a time if we can. Some patients, if they had surgery on a leg, can develop swelling in the lower part of the leg. Typically that is just called a seroma, so it's the liquid portion of the blood that's just kind of pooled in that area just because of all the disruption that's occurred from surgery. So if you're seeing the leg down below is looking really puffy, it looks like it's jiggling like jello, that's a seroma, and that we can take care of pretty easily. We want to warm compress that area of swelling. Even if you're still icing the surgery site, warm compress the area where the swelling is 4 times a day with that warm compress, and that will just kind of help dilate those blood vessels and pull all that fluid out of the tissue and resolve that swelling. We also want to do some massaging after surgery, and massage initially is going to be a real light skimming massage. So it's basically there to improve circulation and relax and provide some nerve stimulation. So you want to work from the lower part of the body moving towards the heart. So if we had surgery on a leg, you want to start at the toes and work your way up towards the heart, just using a light skimming motion, just almost like you're petting them, a nice soothing kind of a pet. And you're going to do that for 3 to 5 minutes. And again, we want to do that about every 3 to 4 hours if we can, but we want to do it at least 2 to 3 times a day. And that light skimming massage is for the first 3 days. The second 3 days, we can move to a little bit deeper massage. That massage is an effleurage style of massage, where we're going to do that 2 to 3 times a day, and that's going to be for 10 to 15 minutes. And that one is going to be a little bit different. We're actually going to be pushing into the skin a little bit, and you're going to be pushing just so you see a little skin roll develop. And you just kind of push again towards the direction of the heart, and it's going to be, just pushing and skimming and just making the skin roll a little bit as you're doing that type of massage. And we want to do this type of massage again 2 to 3 times a day for 10 to 15 minutes each session until suture removal. And then once sutures are removed, we're going to do a little bit deeper form of massage. And we'll have another YouTube video demonstrating that. So, look into that following this one. But start with the light massage immediately after surgery until sutures come out. We will have you start something called passive range of motion therapy also. It's just a series of flexion and extension exercises. Those start day 6 after surgery. And again, we'll have another YouTube video specifically on passive range of motion, demonstrating how to do that procedure so that you'll become proficient. But our technical staff can also go through that with you at the discharge time. And please feel free to call and ask any questions that you have, along the way. The big take home, in terms of post-op care for an orthopedic patient is really activity restriction. If your pet has had a procedure where the bone has been cut in any way, the way that bone heals is that first the body sends new blood vessels across that area where the bone has been cut. And then once those new blood vessels have matured, then the body sends cartilage over. And that cartilage takes a little bit of time to mature also. And then once that occurs, then bone is laid down. So if you are allowing your pet too much activity, even if there's implants in there that are holding everything stable, we can still get some micro motion at that surgery site. And if there's too much of that motion, it can actually break down the new blood vessel development or the cartilage formation, and that can actually delay healing. So activity restriction, even if it seems like, you know, they're not doing a lot, sometimes that is even too much. So we really want to keep them restricted to allow that bone to heal, and for other procedures we want that soft tissue to heal so that we're not going to have any complications afterwards. Again, you know, if you have any questions, you know, always please feel free to give us a call here at the clinic. We're happy to answer questions at any point, you know, direct you to other videos or other sources, you know, whatever we can do to help make your pet's care easier. Our goal is to help you feel comfortable in caring for your pet at home, so that way the process, you know, towards healing and getting them back to returning to normal activity is positive for both you and them. Thank you so much for watching.